Hello and welcome. My name is Maggie Griffith, a nurse for the past 6 years. Thank you for taking the time to join me in this training today. As a new nurse in an acute care setting, there are so many aspects to consider in regards to the care you provide. Sometimes it can feel overwhelming to know where or how to start. One organization, the American Nurses Association, back in 1998 developed a system known as the National Database on Nursing Quality Indicators, otherwise known as the NDNQI. According to Sage and Harris in their 2018 study, the NDNQI was started, quote, as an effort to collect and build data to enhance nursing knowledge related to factors that reflect the structure, process, and patient outcomes of nursing care. There is a long list of quality measures that are monitored and the nursing sensitive indicators that they include. Sage and Harris note that nursing sensitive indicators are distinct and specific to nursing and most influenced by nursing care. For the purpose of this training, we will be focusing on hospital-acquired pressure injuries, or HAPIs. Amen et al. In 2019 further describes that nursing sensitive indicators such as HAPI prevalence were implemented as measures of safety to evaluate the quality of nursing care delivered by healthcare facilities. So why HAPIs? To quote Gupta et al. In their 2020 study, HAPI significantly increased healthcare costs, including the use of resources, dressings, support surfaces, nursing care time, and medications. They also have a significant impact on patients in terms of pain, worsened quality of life, psychological trauma, and increased lengths of stay. Amen et al. Goes into a little further detail that each HAPI increases the average length of stay to 13 days. Readmission rates are higher, and the mortality rate is roughly 9%, which is much higher than in patients who don't develop a HAPI. And while the actual costs associated with them varies, the average is estimated to be an extra $43,000 per pressure injury. Waugh and Beringer-Bergquist reflected in their 2020 study that there were more than 1 million HAPIs in 2014. So you can see where that cost can really add up and where patient safety and quality can suffer. In terms of why new nurses need to be aware of HAPIs and how to identify, report, treat, and help reduce them, Amen et al. Summarizes the importance by stating that with an aging patient population, high acuity and comorbidities, and changes in the government-mandated payment incentives, hospital-acquired pressure injuries remain one of the biggest challenges faced by healthcare organizations. As a frontline provider and one who will be doing comprehensive skin checks on patients, your role to help reduce pressure injuries from occurring is huge. Now let's talk about data collection. First, there is a set schedule and structure for collection of data for NDNQI. To quote Waugh and Bergquist-Beringer, the NDNQI data collection on HAPIs occurs quarterly during a cross-sectional survey that is performed in one day. Data on pressure injury presence are obtained by visual inspection of patient skin. Data on performance of HAPI risk assessments and prevention interventions are gathered on the same one-day skin assessment, but by patient record review. This is typically done in our organization with skincare rounds made by a certified wound and ostomy nurse, as well as the assistant unit directors and nurses who have volunteered to receive additional training to become unit champions to help with quarterly surveys. Shorter surveys are also done weekly on the unit on Wednesdays, in addition to the quarterly surveys for NDNQI. While the primary surveys are done mostly by nurses, an interdisciplinary approach is needed to monitor and document patients who are at risk or who have already developed a pressure injury. To quote Gupta et al. In their 2019 Pressure Injury Quality Improvement Project, they found that this included nurses, physicians, dietitians, physiotherapists, respiratory therapists, wound care nurses, and quality advisors who formed a highly successful and motivated working collaboration. The next point to cover is how is this data shared once it is collected? Waugh and Bergquist-Beringer state that the National Database of Nursing Quality Indicators allows for within and across unit and facility comparison of HAPI occurrences. So you will notice on the walls of our nursing station and nursing stations throughout the hospital that there are graphs that display the result of each unit and each hospital in our network for the most recent survey completed. For units that performed below the benchmark limits, their results are in green. For units that had HAPIs above the benchmark limit, their results are in red. Quoting Amon et al., these surveys allow staff on each patient care unit to have a clear understanding of their HAPI prevalence and target efforts to identify gaps, resources, and opportunities for continuous improvement. Lastly, for today, we will cover the importance of timely and accurate data collecting and reports on the part of nurses. The Agency for Healthcare Research and Quality provided an excellent summary when they stated that a basic principle of quality measurement is, if you can't measure it, you can't improve it. Therefore, pressure ulcer performance must be counted and tracked as one component of a quality improvement program. By tracking performance, you will know whether care is improving, staying the same, or worsening in response to efforts to change that practice. For our organization, charting is twofold. It is important each shift to perform a comprehensive skin assessment and document whether a patient has any pressure injuries present or not, as well as charting the interventions such as repositioning, barrier cream application, dietary consults, etc. The other part of charting requires a Braden assessment, where you answer questions regarding a patient's risk for skin breakdown, and a number on the scale is generated to tell you their risk level. Waugh and Berquist-Beringer remind us of the importance of this task by stating that attentiveness to data collection processes is critical for obtaining high-quality data to evaluate healthcare processes and outcomes, and that persons providing pressure injury preventions need to be informed to document these interventions in all applicable locations for later quality indicator data collection. Lastly, to summarize the effect that using NDNQI data can have in helping to develop evidence-based improvement practices, Amon et al. Provided their results, which led to a very impressive 1,000 days of being HAPI-free on their med-surg telemetry unit. And they stated that a comprehensive HAPI prevention program, increased staff awareness, and interprofessional collaboration were effective in reducing HAPIs and decreasing the associated costs. The unit culture shifted to a comprehensive preventative focus. Unit staff assess challenges and barriers at the patient, staff, and hospital levels to maintain attention on HAPI prevention. Data collection and monitoring provides feedback to the staff and organizational stakeholders. In conclusion, there are a lot of important patient safety and quality issues that nurses need to be ever vigilant about addressing. As frontline healthcare workers, we are closely and frequently monitoring patients, and we can have a huge impact on keeping patients safe. Monitoring for the risk and preventing HAPIs, as opposed to treating ones that have already occurred, is an important shift that needs to happen in healthcare. A major component of that kind of quality improvement comes from thorough, timely, and accurate assessments and charting for both in-house surveys as well as the reports that are shared with NDNQI. I want to take the time to thank you for listening to this training today and encourage you to consider the implications of HAPI reduction in your daily practice.